at $185,000. A lot of... Whoa, okay. Yeah, that makes sense. Like a bunch of other conditions, and then towards the end it says heart attack and death. So I wish I had done it a little bit sooner. Hello, it's been a while since I've done an update video about what's going on. But the biggest thing is that I am getting my jaw surgery in 2 weeks, exactly 2 weeks from today. It'll be on November 4th at the Miami Valley Hospital in Dayton, Ohio. Hopefully, if you're going into this process, or if you don't know what to expect, I hope that you can find this helpful. I think since my last update, I had 2 other orthodontist appointments where I got new wires in, which essentially was kind of like getting your wires tightened. But as I have talked about in my previous videos, they don't tighten the wires, but they just rather put in new wires each time because of like this new technology that they have. And the very last appointment I had was on October 1st with Dr. King in Centerville. And they put in stainless steel wires this time. And I don't really know what that means. But I know that it wasn't stainless steel up until now, because he made a very distinct comment that now we're going to be putting in stainless steel. And then he told me to go ahead and give my surgeon a call. And my surgeon is Dr. Miramati. My orthodontist said, you know, like you're probably ready, but I just want to make sure that there doesn't, if he wants any last minute changes, then he can tell Dr. King. So I talked directly to this very, very nice lady named Caitlin. I guess she's like Dr. Miramati's like first assistant. And I talked to her, and she's like, oh, we'll get you in next week. So I went on October 11th or something like that, only a couple days later. And my doctor said, oh, yeah, like, I think your teeth are ready, but let's go ahead and get, like, a scanning of your teeth. I don't know what the technology is, but they put this small machine in my mouth and got, like, a 3D picture of all of my teeth, and then they 3D printed it. But essentially, Dr. Miramati said, yeah, you're ready to go. So when do you want to have your surgery? And the plan all along from the beginning was to try and aim for December. So going in, I thought, oh, like, I really hope I can do it in December, and then maybe not like January. But I said December, and he's like, oh, that might not be good, because I'm going to be gone for a vacation. Because obviously the holidays are right around that time. And he said he's going to be gone for 2 weeks, and then up until March, he will be in and out of the office. And she said, I don't want to do that to you, which I took that as a total green flag, because I'm like, okay, thank God he actually like cares about me and my recovery phase. And he said, I would say I want at least 4 weeks where I will be in town. So you're either going to have to do it in November, or we have to wait until March. And then by that point, I think there was like 3.5 weeks until November. And the 2 dates he gave me was November 4th and November 18th. And, you know, November is so soon. But, you know, I was like, I might as well get it over with as soon as possible, so that hopefully I can be okay for Thanksgiving, because I'm supposed to go to like a cabin retreat with my husband's family I'm sure I won't be eating anything, but I'll just like take a blender with me. And yeah, so I was like, okay, yeah, let's just do November 4th. And then from there, things started rolling really fast. I got a call from the hospital. They told me what the charges would be after insurance. And these numbers are so interesting. So the hospital will send you a separate bill aside from the surgeon, because the surgeon's office will send you a different bill. So after insurance, my charge was, I was responsible for $4,152, but they told me if I paid right now, they would give me a 5% discount. So I went ahead and took it because I've been saving for the surgery. I've saved all the way up to my out-of-pocket maximum for my insurance, so that, you know, I was pretty sure I was going to max it out. So I just saved that amount. So I was like, oh yeah, sure. Like, I'll just pay right now. And the total was $3,944.40. So I went ahead and paid that. And then for my surgeon, which I talked to Caitlin about, she said that my charges were $6,000 something. It was like, oh yeah. So it was $6,800-ish. I think before insurance kicks in, which I thought it was really, really low. But that's the number she gave me. And she said after insurance, it's going to be $1,722. Which I was very shocked at how little the price was. But one thing that I completely missed at my initial consultation with my surgeon was that he said that there might be a possible genio, which is they like alter your chin so that it can give you more of a balanced and symmetrical face. And she said if he decides to do that, it's going to be like an additional $3,700 something. I'm not sure if that's covered by insurance because I've heard that that's cosmetic. So I'm just waiting for an answer on that. But either way, I just leave it up to my doctor because I trust his judgment. And so there is a possible like extra $3,000 whatever cost that I might have to pay aside from insurance, but that's okay, I guess. So far I've already made the initial payments to the hospital and the surgeon, which has added up to about a little over $5,000. But what's so crazy is that I asked the people at the hospital before the insurance kicks in, how much is the hospital charging me? And they said $185,000. And then there's an additional $16,608. So thank God for insurance. I have Blue Cross Blue Shield, the HMO plan. And I have the gold, where the deductible is $1,500. And once you hit that, they cover 75% of all of your hospital bills. So I'm only responsible for 25% of what I get charged. But yeah, like I'm going to hit my out of pocket, which is $8,700. But I've already spent the first $1,500 on something else earlier this year. So I guess at the end of it all, I'm paying like $7,000 for the surgery, which honestly, it's not that bad. And then additional $9,000 something for my my braces, because I did an expedited version. And if you watch my other videos from the beginning, I'm kind of on a time crunch because I'm 29, right now, and then I'll be 30 next July, and I really want to get this over with before I'm 30. So that's what's going on so far. So I am on my way to get surgery in 2 weeks from today, which is, it's insane. And there's a very helpful group on Facebook called the Jaw Surgery Support Group. If you've never heard of it, you should definitely check it out. If you don't have a Facebook, I would get it just for that. It's so helpful to see, other people's transformations, the ins and outs of recovery, and, overall, like, seeing how ugly things can get once the surgery is over. I've seen so many of these pictures where people's faces are just super swollen. Their lips are ginormous. Because I'm glad that my initial feelings of being terrified aren't happening right now. Like, I've already dealt with it for like the past 8 months, so I feel pretty ready. The only thing that I'm very scared about is that I'm having a double jaw surgery, and my surgeon said that he's moving my top jaw like a little bit forward. He said he's doing something where it's called meeting in the middle, moving this a little bit forward and then moving this a little bit back. He said he'll move those 6 to 7 millimeters back, which I don't know if that's a lot or not. And the method that he's going to use for both of these is they're gonna do it from the inside. So they're not gonna try to like cut open from my skin and do it. So that means my mouth is gonna be super wide open, but my mouth is already very small. So I am so scared that like my mouth is gonna rip open. Which I think if it does happen, they're just gonna stitch it. And then in terms of my lip swelling, he said that they provide steroid cream. And, I'm going to be on liquid Vicodin for painkillers for the first few days. So I probably won't be able to feel it. He said that they're going to saw my bottom jaw here. There is another method that they use, and I forget, but he said that the other method, it causes too much strain on the joint. And the way that he's going to do it, there's less strain on the joint. There's less possibility for nerve damage that way. So I think they told me to come in 2 hours before the surgery starts. They told me that it will start at 8:15, so I have to come in at 6:15. I actually have no idea how long the surgery is going to take. So that's all I know so far. I already have a blender. I bought some syringes and a squeeze bottle to help me with my liquid diet the first few weeks. I just bought a feeding syringe. It's a 3-pack of 60 milliliters, and then a squeeze liquid bottle for 16 ounces. So I'm doing this for the first time. Oh, wow, these are huge. I didn't buy these on Amazon because I don't really trust anything on Amazon, especially if they're plastic. So I went ahead and bought these from Cranio Rehab. Yeah, it's a company based out of Denver, Colorado. So yeah, this is my feeding syringe. You can probably have a lot of... Whoa, okay. Yeah, it's just like... Yeah, I mean, it should probably be enough that I don't have to refill it too often. And then I also got this Nutri-Squeeze bottle. Wash before use, and it's dishwasher safe. BPA and latex free. So this is what that looks like that. There's still some other things that I need to buy. Costco has a Kirkland brand bone broth, chicken bone broth, and it has 10 grams of protein per cup, I hope. Maybe it's the whole packet, which is like this big, but I'm gonna try to blend up some pasta and make it into a really thick liquid so that I can try and eat more while I'm recovering. This past month, I've been trying really hard to eat more so I can gain more weight. I think I'm at 105 now. Maybe a month or two ago, I was like 102, 103. So I've gained about 2 or 3 pounds, which is great. But I'm going to try to eat even more for the next 2 weeks. And eat out a lot so that I can enjoy good foods. And hopefully that'll just help me put on more weight. I was told to just take off work for 4 weeks. So I'm a self-employed worker, so that was easy for me. I can, take time off. My husband luckily has 2 weeks off of his work from the point where I get my surgery, just by coincidence. So that'll also be great because I'll have a caretaker. And this is a huge box of it's like a cooling jaw, I don't know what to call it. It's a compression therapy. So it's gonna look like that. So it's good for icing and heating. So this even has the operating examples. So I guess you fill it up with iced water bottles and then put some ice in it, and it keeps it cool for a couple of hours, I think. I bought this from somebody who is already done with their jaw surgery. She said it was still like really clean. So I bought it from her for about $118. I think she bought it for more than that, like a lot more than that. I know the person that I bought it from, she said that it made it a lot easier than having to switch ice packs all the time, and refilling things with ice. I can imagine that can get a little overwhelming. Like I said, I think the first few days you're supposed to do cold. And then from the 3rd day after the surgery, it should become hot and cold. Man, this is a lot to remember. But there's this really helpful sheet here. Maybe you can screenshot it and read through it to see if you are interested in having that. I'm not going to see my surgeon until the surgery day. I went in last Thursday for a physical, which they just took my blood pressure. She listened to my lungs. And that was it. Very easy. And I asked my surgeon a lot of questions. He answered all of them. And then you have to sign a consent form, which it's a little bit scary to sign it because the scariest thing for me is the anesthesia. And not that I've ever had a problem with it, knock on wood. But, they write down, I understand the possible side effects of anesthesia, which can be nausea, pneumonia, and then towards a bunch of other conditions. And then towards the end, it says heart attack and death. So, But the thing is, you have to sign it. You know, that's just how it works. So that it's a little bit scary. So you just have to be ready for that last appointment to ask all your questions. I asked him about the possibility of my body rejecting the metal, which I've read a lot about on the Facebook group. And they say like, oh, it's like coming loose and my body is rejecting the metal. But the doctor was like, I really like haven't heard of that. I've heard of it coming loose, but not rejection. And if it is rejecting it, I've only dealt with it with one of my patients who, he does teeth implantation and he uses titanium. So he says that it's so rare to have that kind of thing where the body rejects it. And he said that he tried it, I forget, like 3 times, but the patient's like gums just wouldn't take it. And he said that was one time out of the 10,000 times I've done it. So I was very comforted by that. Another question I asked is about if my nose will change. And that's super important to me because I think I've hated my nose growing up. I didn't really like it, but I like it now. It's fine. Like it's not, I've grown to like it. He said that it's possible that, you know, your nose might get a little bit wider, but your upward jaw movement is not going to be big enough to make that big of a difference. So he said if in that moment, if he thinks that if it's creating making my nose super wide, he can like stitch it. I think it's called cinching, which I've also read about. But I decided not to be too worried about that. I'm gonna let it go. I also asked about relapse, and he said I wouldn't worry about that for you because your movements aren't that big, and relapse is more common in people who have expansion in their upper jaw because I guess the bones try to come back together when it's trying to heal. But I don't have to do an expansion, so that's not something I have to worry about. I was considering maybe I should do myofunctional therapy, which is, I guess, like therapy for your tongue and facial movement to avoid relapse and learning proper tongue posture, whatever that means. But we'll see. We will see if I'm gonna do that. So I'm optimistic that, you know, my body will take this well. I plan on taking vitamins and supplements through my foods. I'm going to crush up a pill, and hopefully that will also help with my recovery. I'm going to try this out for the first time. So I guess you put this in here. I don't want it. Okay, there we go. And then what? Where are the... Oh. How is this supposed to... Oh, okay. I guess... Oh, God. Ooh. So I guess there's like a tube right here. So I think that's where the water goes in, and then it cools this pad, and then it just circulates to keep it cold. Okay, that's pretty smart. I just don't know how to get this thing in.
What? Oh, I'm so glad I'm doing this right now.
There's a warning saying that this pad is cold enough to seriously injure skin. Put an insulation barrier between the pad and the skin. do not let the pad directly touch the skin. So this is the insulation barrier. Cranial rehab. Wait. Oh, it's the same place where I got my syringe. Okay, that's cool. There is this pad with Velcro on both sides. Velcro on both sides, and there's a hole in the middle. And I'm pretty sure I'm supposed to put the pad through that because I can't take the tubes off.
So I do this. Yeah, I mean, the pad is very flexible and thin, so. Okay, I didn't know it. There we go. Okay, so now it's in here. This is the insulation barrier. So I guess I go like this. Yeah, that makes sense. Do this. I'm very scared of this Velcro getting in my hair. And then the back so that it doesn't slip off. There's
Smart. Okay, this is already pretty cold. I can see this working. So it looks like that from the back. And then it comes with a power outlet that goes right here. And you just plug it in, and then I think it just... So other than that, I'm going to show you what my smile looks like. So, as promised, the orthodontist told me that my bite will get worse before the surgery. And the way that he explained it to me was that they basically widen the teeth out so that it's an optimal position for surgery. I don't know anything about that, so I just took his word for it. But I was ready for it to be, for it to look worse. I don't hate it. I don't think it's that terrible, but it is definitely worse because there's like a huge gap here. And then what's interesting is this side doesn't look that terrible. So it's this side is an underbite, this side is it's a underbite and crossbite issue. I'm optimistic, but I'm obviously very nervous as well. I don't know how long the surgery is going to take. That is something I asked the office, and hopefully I'll hear back from them soon. I will try to keep like a vlog of the surgery day. I don't know how well that's going to go, but I will try to do that and update the channel as much as I can. And like I said, I'm doing this to hopefully help somebody else out who wants to get their surgery done. I wish I had done it a little bit sooner, but you know, here we are, and at least I know for sure that I'm done growing, or my face is done growing at least, so it's safe. And I've heard that doing it younger gives you a higher chance of relapse because your jaw still might shift around. I'm really thankful that it's happening a lot sooner. And I hope by, you know, January or something, I will be normal. And yeah, I just don't know what to expect in terms of getting used to my new face. I am just hoping for the best. And if there's anything I learned from the jaw surgery group, is that you have to be really patient. You have to be so patient for the recovery process. And I mean, not only that, you have to be so patient through your braces. I hate the way I look in pictures now because I feel like I look like I have cavities in every picture, or like grills, you know? And it's just, it hasn't been fun at all. And eating is a pain in the ass. You know, everything gets stuck in my braces. And the wires poking out and stabbing your cheek, also not fun. Putting wax in your teeth all the time, not fun. But I will say one good thing I got out of this is that I probably have better oral hygiene now. Because I'm water picking all the time. That's the first time I went to the dentist, like a month ago, and they were like really proud of my teeth. They're like, wow, it's really clean. So that's one good thing that I got out of it. And like I said, I will try to keep a video vlog of how everything goes on the day of, and hopefully I can get that posted to the channel. And I hope you guys found this video helpful, and thank you for watching.